Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, and we're going to be covering pharmacology, but specifically, we're going to be going over drugs that affect the neurovascular system. So we're going to be covering medications given for neurological disorders. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking the video. You're going to love it. Go ahead and give a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. You will find a variety of resources there. Again, the website is nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms such as TikTok, Instagram, Facebook, YouTube. My handle is the same everywhere, Nexus Nursing. Without any further ado, guys, let's get started. Pharmacology, neurological disorders. First question, which is a priority nursing assessment when administering mannitol to a patient with increased intracranial pressure? Would it be the heart rate, the lung sounds, the urinary output, or the pupil response? Which would be your priority nursing assessment when you're administering mannitol to a patient with ICP? Now, just so you guys know, when you guys are looking at these testing questions, whenever they give you disorder and they also give you a medication, 99.9% of the time, the question is about that medication, not the disorder. It's the medication that's going to cause a change in that patient's body. Okay. All right. Correct answer. Wow. Only 24 of you guys went with urinary output. Most of you guys went with pupil response. You see what you guys did? Exactly what I just told you not to do. That's what you guys did. You guys were focused on the ICP, the increased intracranial pressure, and not the drug, mannitol. Let me repeat what I said to you before. Whenever you have a test question and they give you a disorder and a drug that you're either about to give or that you just gave, 99.9% of the time, the question is about the drug, the thing that's going to cause a chemical change or a change in that patient's body. They already have the disease, right? So those who said people response, you were answering because you were looking at ICP and not mannitol. Let's talk about this. What is mannitol? Mannitol is an osmotic diuretic. What do diuretics do? They make you urinate. So wouldn't it make sense that a priority assessment would be to check urine output? Duh. Is the drug working? It's a diuretic. It makes you urinate. We want to check the urine output and see, is the drug working? With that urine output, you'll know the efficacy of the drug. Yes. So if the patient has thank you for asking that question. If the patient has increased intracranial pressure, we're trying to decrease that pressure. So all of that pressure, the swelling in the brain, we're trying to get rid of that fluid. And so that's why that patient's getting that diuretic so it can help decrease the fluid and decrease the pressure. Next question. A client taking Phenytoin reports bleeding gums. What action should the nurse take? Oh, look at those. Instruct the client to increase vitamin C, suggest a mouth rinse, assess for gingival hyperplasia, or advise stopping the medication. A client taking a Phenytoin reports bleeding gums. What action should the nurse take? You guys know I can't pronounce. Very good. You're gonna assess for gingival hyperplasia. So guys, this drug, it's a anti oh my gosh, anti-seizure drug. And one of the adverse effects is that it can cause gingival hyperplasia. So you're going to be checking that patient's gums. Let's no, You're not going to advise the patient to stop taking that medication. The reason you're not going to do that is number one, you're not the healthcare provider. Number two, this is an adverse effect of the drug. We know that it's an adverse effect of the drug, so it's something that we're going to be watching out for. But you're not going to tell them to stop taking the drug because the healthcare provider may not change the drug. Maybe they'll change the dosage. Maybe they will change the drug. However, because we know that this is an adverse effect, this is something you're going to assess for. Remember the nursing process, guys. The very first thing you're always going to do is get information. You're going to assess. You have to get information first. You have to assess first before you can perform a nursing intervention. Okay. Make sure you guys know the adverse effects of this drug, dizziness, tremors, double vision, slurred speech, and of course, gingival hyperplasia. Okay. Which statement indicates understanding of carbamazepine therapy? If the client states, I can drink grapefruit juice with this drug, I'll take it only when I feel seizures coming, I'll avoid driving until I know how the drug affects me, or I don't need any blood tests while taking this drug. What do you guys think? Very good. I'll avoid driving until I know how the drug affects me. The fact that I even told you that these questions are going to be about drugs that cover the neurological system, you know it's something that's going to affect the brain. So yes, you're going to teach a patient to avoid driving until they know how it affects them. Let's talk about this drug. What kind of drug is it? It's an anticonvulsant, and it can cause CNS changes, dizziness, drowsiness, ataxia. So there are a lot of safety issues associated with this drug. Make sure you guys know those adverse effects and you know the nursing interventions. No, you should not drink grapefruit juice with this drug. It decreases absorption. And look at the other option. I'll take it only. How many times do I have to tell you? When you see that word only in the answer choice, 99% of the time it's wrong. Stay away from those all inclusive types of words. And then last, I don't need any blood tests while I'm on this drug. You absolutely do. You're going to be getting blood tests periodically to make sure that you're not having any toxic levels in your system. A nurse is monitoring a client on Valproate. Which nurse value is most important to assess? Would it be hemoglobin? Would it be liver enzymes? Would it be blood glucose? Or would it be BUN creatinine? A patient has been prescribed Valproate. Which lab value is most important to assess? Okay, very good. Liver enzymes. This drug is very, very hard on the liver. Now, when it comes to drugs across the board, we're going to be concerned about the liver. We're going to be concerned about the kidneys because the liver is responsible for metabolizing the drugs and the kidneys responsible for excreting the drugs. Absolutely. However, for this question, you guys, it would be okay if you were between liver enzymes and BUN and creatinine, liver enzymes for the liver and BUN creatinine for the kidneys. But this drug is very, very, very hard on the liver. And so that's why you're going to be paying attention to those liver enzymes. You're going to be looking at the AST, the ALT. You're going to be looking at those enzymes because you want to make sure it's not damaging the patient's liver. Clonazepam is prescribed for a patient with seizures. What is the primary nursing consideration? Is it monitor for skin rash? Is it watch for sedation and respiratory depression? Is it encourage caffeine use or is it to assess for extrapyramidal symptoms? By the way, that other drug we were talking about, Valproate, I don't know if I don't remember if I told you or not, but that's an anticonvulsant agent as well. Okay, let's talk about this. Clonazepam, what kind of drug is this? This is a benzodiazepine. Okay. It's a benzodiazepine, and the question is, what is a primary nursing action consideration? And 70 of you guys said watch for sedation and respiratory depression. So, um, I don't know why I have assessed for extrapyramidal symptoms because it is sedation. Benzos depress the CNS symptoms. It causes symptoms such as, sedation, which is a big safety issue. It can cause respiratory depression. You want those respirations to be between 12 and 22. So sorry. You guys were right. I put a check next to extrapyramidal symptoms, and that's absolutely incorrect. Something else, you guys. So I'm sorry. Forgive me. Um, before I move on, a couple other things you guys need to know about benzos for testing purposes. Benzos are given for short term. You're never going to see that ordered long term, and the reason why is because of dependence. Okay. Patients who take benzos, they are at high risk for becoming addicted to them. So they're going to be given short term. So sorry about that. Vasopressin is given to a client with diabetes insipidus. Which is the most concerning finding? Would it be slight headache, a weight gain of a pound, crackles in the lungs, or increased thirst? Come on, guys. I want you to think about this. Very good. Crackles in the lungs. So this patient is getting vasopressin. Vasopressin, guys, is also known as what? ADH, antidiuretic hormone. Why are they getting vasopressin? Because they have diabetes insipidus. Do not mistake diabetes insipidus for diabetes mellitus. When we're talking about diabetes mellitus, that's when the patient's blood glucose is too high. But when we're talking about diabetes insipidus, that's when the patient does not have enough ADH. They do not have enough antidiuretic hormone, which means they are urinating all over the place. Their urine output is up. Their urine specific gravity is down. Okay. Why? Because they're urinating all over the place, but all of the solutes is staying in the blood. So when you look at the serum osmolarity, that is up. But let's go back to vasopressin. Vasopressin again, it's also known as ADH, and what it does is help control the fluid. So it helps make the patient not urinate as much. So if they're holding on to the fluid, that fluid may back up and back up and back up and spill into the lungs. We're going to be very careful about that. So if we hear crackles in the lungs, we're going to let the doctor know, the healthcare provider know right away. Should there ever be fluid in the lungs? Absolutely not. Okay, what is the purpose of dexamethasone in clients with brain tumors? Is it to prevent seizures? Is it to reduce cerebral edema? Is it to treat infection? Or is it to lower blood pressure? Dexamethasone. What is the purpose? What is the indication for dexamethasone in a patient with a brain tumor? Prevent seizure, reduce cerebral edema, treat infection, or lower blood pressure? Very good. We want to reduce cerebral edema. Dexamethasone is a corticosteroid. What do corticosteroids do? It decreases swelling, right? Let's look at the wrong answer choices. Prevent seizures. Those would be like anti-epileptic medications or anti-seizure drugs. Treat infection. Those would be like antibiotics or antiviral agents. And last, lower blood pressure. Those would be antihypertensive agents. Do you notice whenever I refer to drugs, I keep talking about their class? There's a reason I'm doing that, guys. This is how you need to learn the drugs. There is no way you're going to know every single drug. You need to clump them into drug class so you know that the beta blockers do this, the calcium channel blockers do that, the corticosteroids do this. Don't try to learn them one by one. Clump them into a drug class. It's going to make your life so much easier, I promise. Okay, carbidopa-levodopa is prescribed for Parkinson's disease. Which statement by the client shows understanding? This medication will cure my condition. I can stop taking the drugs once the symptoms improve. I may notice my urine is darker colored, or I should take it with a high protein meal. Which statement by the patient shows that they understand teaching about carbidopa-levodopa? Very good. I may notice my urine is darker colored. That is a side effect of the medication, but it's harmless. It doesn't do anything to the patient. Now let's look at the wrong answer choices. This medication will cure my condition. No, it won't. There is no cure. Okay? It will treat it, but it will not cure. I can stop taking the drugs once symptoms improve. Whenever you see an answer of the patient say, "Oh, I can stop whenever I feel better," that's always the wrong answer, right? So no, because guess what? They're going to stop taking the drug and then the symptoms are going to come back. And last, I should take it with high protein meals. No, high protein meals are going to decrease the absorption of the drugs. High protein meals across the board, usually, there are some exceptions, but usually they're going to decrease absorption of the drug. We don't want them to eat high protein meals with the drug. Okay, I can't speak. You see that drug? The name of the drug that starts with a P is most appropriate for which condition? Is it seizures, multiple sclerosis, Alzheimer's disease, or Parkinson's disease? I don't think I had my coffee when I made this Kahoot. You guys are all over the place on the live. Parkinson's. Only 17 of you guys went with Parkinson's. It treats Parkinson's. It actually also treats restless leg syndrome as well. It treats Parkinson's and restless leg syndrome. Okay. Make sure you guys know this drug. Last question. Amantadine is used in Parkinson's disease because it does what? What is the action of this drug? Is it to prevent dopamine breakdown? Is it to promote dopamine release and block the reuptake? Is it to inhibit serotonin? Or is it to enhance acetylcholine? Amantadine, what is the action of this drug? Congratulations, Giovanni. You're welcome. Okay, let's talk about it. Very good. Promotes dopamine release and blocks reuptake. That is the action of the drug. The first one where it says prevents dopamine breakdown. Nope. The MAOBs, those are the drug classes that prevents dopamine breakdown. Next, inhibits serotonin. Nope. We'll see that with the SSRIs. We'll see that with the SNRIs. We'll even see that in some of the TCAs, but not this drug. And last, by the way, amantadine, it's an anti-Parkinsonian agent. And last, enhances acetylcholine. Well, guess what? We need the opposite, right? So that couldn't be the answer. The correct answer is promotes dopamine release and blocks reuptake. All right, let's see how you guys did.